Heart Awareness Month, promoting good lifestyle and making changes in order to maintain a strong heart. Heart diseases is the biggest cause in death in several Indian men as well as women. TV Asia decided to discuss about this topic with the renowned Indian Dallas-based cardiologist Dr. Gaurav Gupta. Dr. Gupta has dedicated his career to treating and making difference in the lives of heart disease patients. Here is the segment with another top Indian cardiologist in the US.
So, Dr. Gupta, tell our audience, what are the risk factors for heart disease?
So when we talk about heart disease, we talk about the traditional major risk factors for heart disease, which includes diabetes, high blood pressure, high cholesterol, and smoking. In addition, there are other risk factors like obesity and lack of exercise. These are, by and large, the major risk factors for heart disease. South Asians have amongst the highest risk of heart disease in the world. On average, the risk of heart disease amongst people of Indian origin is almost 3 to 4 times the risk of the white population in the United States. And when you look at Indians, the risk of heart disease is primarily because of 2 reasons. One is the higher prevalence of diabetes, and the second is our cholesterol. So even though Indians on average don't look to be as obese as some Caucasians, they have the wrong distribution of fat. So Indians tend to have more of what is called visceral fat, which is fat which deposits in the middle part of our body, resulting in a bigger waist circumference. And that is what is unhealthy. Indians eat a lot more carbohydrate-rich diet, and our carbohydrates are more of refined carbohydrates. So, the rice and the wheat and the flour that we have is more refined and not whole grain. So modifying our diet can go long ways in reducing the risk of heart disease amongst Indians. Indians tend to be more sedentary, exercise less frequently, and on average, we recommend that everybody should exercise for around 30 minutes, 3 to 4 times a week. And exercise should be such that it raises your heart rate to what we call the target heart rate. It's important. Brisk walking would be walking at around 4 miles an hour speed, or so 4 miles an hour would be you're basically doing a mile in 15 minutes.
Let's touch upon the advancement in technologies that are helping doctors in engaging with the patients.
So we have new technologies, new devices, new kind of stents that help fix the blockages, and now we even have devices which are approved which can remove the plaque in the arteries. That's one arm of how technology is helping us do a better job in taking care of our patients. The help that technology is giving us in making our patients more aware of what is going on in their bodies.